Good morning, student. In our last video, we are discussing our fourth unit, Physical Education and Sports for Differently Able, in which we have discussed about disability. Disability, it is a medical conditions which does not permit an individual to perform any activity or movement in a normal way. Means it is mainly related to injury that restrict the functions or movement of an individual. It is a disadvantage that affect the daily life of an individual. For example, if a person has eye disability, then he can't see. Therefore, his daily life is affected. And disability, it can't be cured. There are three types of disability: physical disability, physical impairment, sensory impairment, cognitive impairment. And the cause of disability, it may be genetic, environmental, or some unknown cause like cancer, heart attack, diabetes, musculoskeletal disease, malnutrition, war, pesticides, accident, etc. These are the cause of disability. Next is disorder. Disorders, it's a problem or illness which affects someone's mind or body. Disorders, it is mainly related with the mind. Okay, disorders, it is mainly related to the mind. Disorders, it disturb the daily activity of an individual. Disorders, in the beginning, the disorders seem to be ordinary, but usually it spread in a harmful manners. But in starting, it seemed normal, but after some time, it spread in a harmful manners, and disorders cannot be detected on time. As a result, the disorder changes into disability, and if changes into disability, it can't be cured. For examples, eye disorders. In eye disorders means due to the weakness. Disorders, the disturbance. Disorders, it is a disturbance that affect the daily activity of an individual. For example, eye disorders. Eye disorder means eye weakness. Due to eye weakness, his daily life is affected. He is not able to see properly. If he does not do a treatment of eye, this disorders change into disability. He become completely blind. And if disorders change into disability, then it can't be cured. Types of disorders. There are various types of disorders. The first is attention deficit hyperactivity disorders. In attention deficit hyperactivity disorders, it is also a brain disorders in which the person is unable to pay attention. He is for a few seconds also he is not able to pay attention. Okay, in attention deficit disorders, it is also related with brain disorders marked by an ongoing patterns of inattention, hyperactivity, or impulsivity that affect the functioning or the development. It is related with the neurodevelopmental type. Its symptoms of attention deficit hyperactivity disorders is unable to pay attention. It does not able to pay attention. Excessive activity, doing various excessive activity. Difficulty, he faced difficulty in controlling his behaviors. He will become careless and make many mistakes. And the type of disorders: inattention, hyperactivity, impulsivity. These are the three types of Attention deficit hyperactivity disorders. Inattention means the person is unable to pay attention. Difficulty. He has difficulty in sustaining focus. He is unable to focus on a single point due to lack of concentration, lack of comprehension. Hyperactivity means the person seems to move constantly, continuously moving here and there. It is mainly seen in children. Impulsivity means make hasty actions that occurs in the moment without first thinking. Without thinking, he do various activity, and if he do without the thinking, then it may result in mistake. It is harmful, or desire for immediate rewards or inability to delay gratifications. The cause of attention deficit hyperactivity disorders is genetic factors. It may be due to genetic factors, heredity, low birth weight at the time of birth. If his weight is low, it may also leads to attention. It may also leads to disorders, trauma, brain disease, improper diet, etc. These are the cause of attention deficit hyperactivity disorders. And management. What are the management technique? We can manage through counseling. Okay, we can manage through counseling, changing his lifestyle, conference, medications, behavior therapy, etc. These are the management technique for attention deficit hyperactivity disorders. Next is sensory processing disorders. In sensory processing disorder, it is also a brain disorders in which the brain has trouble in receiving and responding the information that come in through the sense. Okay, the brain is unable to receive and respond to the information that come in through the sense. If he will not receive any message, then of course he will also not respond. If he don't get message, then there will no action, there is no reaction. In sensory processing disorders, his sense is no more responding. Okay, his sense is no more responding. His sense like hearing, touch or taste, etc. If his sense is not response, then he will not feel any pain, and it may leads to harmful for a person. He may fail to respond to extreme heat, cold or even pain. His sense is no more response. The cause of sensory processing disorders, it may be genetic factors, low birth weight, environmental factors, using drugs, brain disease, etc. These are the cause of sensory processing disorders, and its management technique like changing his lifestyle, counseling, meditations by doing meditation, medicine, etc. These are the management technique for sensory processing disorders. The next is autism spectrum disorders. In autism spectrum disorders, it is a brain disorders. Okay, it is a developmental disorders. Autism spectrum disorders, it is a developmental disorders. Therefore, the person face difficulty in communicating and interacting with others due to development. disorders. Okay, autism spectrum disorders, it is a developmental disorders. It include wide range and level of disability. People with attention spectrum disorders often have characteristics like ongoing social problem like facing difficulty in communicating with others, interacting with others, doing the repetitive behavior, as well as limited interest or activities. He face limited interest. So attention autism spectrum disorders, it is a developmental disorders. The development is not proper, therefore the persons face difficulty in communicating, language, social social skill, behavior, etc. His communications problems, language problems, social skill, social interactions. He does not interact in the society due to undevelopment, tendency to engage in repetitive behaviors, avoid eye contact with the other persons, etc. Symptoms of autism spectrum disorders others are: do not be socialized. The persons who is autism spectrum disorders is not social with the other persons, prefer to live alone, feel difficulty in communicating with others, highly emotion, etc. And the management technique for the cause of autism spectrum disorders, it is due to the genetic factors, environmental factors, psychological factors, social factors, etc. Treatment, it management through lifestyle changing, friendly behavior, counseling, changing his environment, meditations, etc. Oppositional defined disorders. Oppositional defined disorders is a conditions in which the child display an ongoing patterns of angry, irritable mood, define on argumentative behaviors, always argue with the others people, does not obey the rules, moody, irritables, violent behaviors, violent towards the other people. The child behavior often display the child normal daily activity, including activities within the family and school. Okay, so simple. The oppositional defined disorders, it is mainly seen in children's. The child it is mainly seen in children's. In this, there is ongoing patterns of angry, irritation, fighting, blaming others, frequent frustrations, always frustration, failure to think before speak. He speak without thinking, feel annoying, emotion, etc. It is mainly seen in children. Many children and teens with oppositional defined disorders has also have other behavior problems like deficit disorders, learning disability, mood disorders, anxiety disorders, etc. Symptoms of oppositional defined disorders. The symptoms is angry, argue with others, blaming others, lose his temper, obey. He does not obey his senior, always aggressive in nature, etc. The cause of oppositional defined disorders, it is genetic, biological, psychological, injury, etc. and its management technique through counseling, family therapy, social skill, meditations, medical, etc. Next, obsessive compulsive disorders. In obsessive compulsive disorders, it is a mental disorders where people feel the needs to check things repeatedly, perform the same things again and again. Okay, in obsessive compulsive disorders, it is a type of mental disorders or mental illness that cause unwanted thought in his mind. Therefore, to get a read from this type of thought, a person do the same things again and again. For example, uh, symptoms in symptoms, for example, people unable to control either the thought or the activity for more than short period of time. Common activity like washing the hand again and again, counting the things, checking if the door is closed or not, etc. These are the some symptoms the persons who have obsessive compulsive disorders. Doing the same thing again and again. He is always in confusions that whether he has done the things or not. And the cause of attention cause of obsessive compulsive disorders, it may be due to environmental factors, biological factors, genetic, low birth weight, brain injury, etc. And its treatment, through counseling, changing his behavior therapy, and sometimes medications, psychological behavior, etc. These are the treatment for obsessive compulsive disorders. Now, these are the types of disorders. Okay, attention deficit hyperactivity disorders, sensory processing disorders, autism spectrum disorders, oppositional defiant disorders, obsessive compulsive disorders. In attention deficit hyperactivity disorders, the person is unable to pay attention, is not able to pay attention. In sensory processing disorders, if his brain is not working, the brain face difficulty in receiving and responding the message that come in through the sense. In autism spectrum disorders, it is a developmental disorders. Therefore, the persons face difficulty in communicating with others, interacting, language problems, social interactions problems, tendency to um, leave alone, etc. And oppositional defined disorders, it is mainly seen in children's irritation mood, always fighting, blaming others, frequent frustrations, failure to think before speak, argumentative behavior, etc. And obsessive compulsive disorders, it is a mental disorders in which there is an unwanted thought in his mind, and to get a read from unwanted thought, he do the same things again and again. Next is disability attitude. Disability attitude, it is a set of guideline dealing with, it is a guideline. Disability attitude is a guideline dealing with dealing specifically with how to approach people with disability. Okay, disability attitude, it is a guideline which guideline for how to deal with a disabled person, the rules of the attitude and good manners. It is a disability attitude, it is a rules of attitude, it is a good manners for dealing with a disabled person. Some Disability attitude. First thing, the disability attitude, it is a guideline how to deal with a disabled person. Some disability attitude are talk directly. When talking with a person with disability, speak directly to that person rather than through a companion or sign language interpreters. Okay, whenever you meet with a disabled person, talk directly to that person, not with the other person. Talk directly with him. Offer to shake hand. When when introduced to a person with disability, it is appropriate to offer to shake hand. Okay, whenever you meet with the disabled persons, offer to shake hand. People with limited hand, if he does not have hand or who wear artificial limbs, can usually shake hand. If you shake hand, shaking hand with left hand is also acceptable greeting. Okay, so first is always talk directly with him, offer to shake hand, explain before conversing with visual impaired. If the person is visually impaired, then explain yourself, who you are and the persons with you. Okay, whenever you whenever you meet with a visually impaired persons, explain yourself, tell about your identity yourself, explain the peoples who are with you. When conversing in a group, remember to identify the persons to whom you are speaking. Ask before the help. If you want to help the disabled persons, first ask him. If he accepts your offer, then only help. Address them by their first name as we do the others. Okay, call him by his name as we call the normal persons with his name. In the same manners, call the disabled persons also with his first name only. Don't touch or lean on wheelchair. Never touch or push the persons who sit in a person with wheelchairs. Okay, don't touch the wheelchair of a person's. Leaning on or hanging on a person's wheelchair is similar to a leaning on or hanging on a person's. So simple, don't touch his wheelchair. Don't touch or push. Never touch or push the wheelchair of a person who sit in a wheelchair. Next is listen them carefully. Um, if the persons have problems in communications, language problems, so listen him carefully. Be patient and wait for the person to finish rather than correcting or speaking for the persons. So listen him carefully, then only if he make a mistake, correct him, do correction. If necessary, ask some short question that require for short answers as nod or shake of the head. Never pretend to understand if you are having difficulty doing so. Instead, repeat what you have understood and allow the persons to respond. The response will clue you and guide your understanding. Offer for help or assistance. People who are blind know how to orientate themselves and get around on the street. They are competent to travel unassisted, though they may use a canvas or a guide dog. A person may have a visual disability that is not obvious. Be prepared to offer assistance. For example, in readings, when asked, speak clearly and slowly, or use body or sign language for hearing disabled. The persons who have hearing disabled Speak slowly. Speak slowly. Okay, speak clearly and slowly so that he understand what you are saying, or use sign language. Relax while assisting or helping them. Whenever you help the disabled persons, be relaxed. Don't feel embarrassed if you are helping others. Your common expressions such as "see you later" or "did you hear about that?" that seems to relate to a person's disability. Do not be afraid to ask questions when you are unsure of what to do. Okay, so always feel relaxed when you help the disabled person. These are the some guidelines which you have to follow when dealing with a disabled person. First is talk directly to him. Offers whenever you meet with a disabled person, offer to shake hand. Explain yourself before conversing with him. With a disabled person, a visual impaired person, ask before help. Whenever you want to help him, ask before him. If he accepts your help, then only help. Address them by their first name as we do with the others. Okay, call him with his name. Don't touch or lean. Push his wheelchair. Never touch. Listen them carefully. If he has problem in communications, language problems, then listen them carefully. Don't correct them. Don't correct their mistake. First give them to complete his offers for help or assistance. Okay, always offers yourself to help the disabled person. Be prepared. Speak clearly and slowly, or use body or sign language with the persons who have hearing disabled. Use body or sign language or speak slowly so that he read your lips. Relax while assisting or helping the disabled person. Feel relaxed. Don't feel embarrassed, uncomfortable. Don't feel. Be relaxed. These are the some disability attitude and disadvantage of physical activity for children with special needs. It is out of your syllabus. Only this much thing. We have completed our 4th unit, physical educations and sports for children with disabled person. That is Divyang. Disability is an impairment that may be cognitive, developmental, intellectual, mental, physical, sensory, or some combination of these means. It is mainly related to the body part. It is a medical conditions. Disability, it is a medical conditions that does not allow an individual to do the activity or a movement in a normal way as a other person do. It is a disadvantage. Disability, it is a disadvantage that affect your day-to-day activity and it can't be cured. For example, leg disability. If your leg is cut, then you face difficulty in walking. And disorders, it is a problem or illness which affect someone's mind or body. Disorders, it is mainly related to the mind. It disturb your day-to-day activity. Okay, disorders disturb your day-to-day activity. Disability, physical impairment, your physical body is impaired. Your upper or lower body is not working properly. Sensory impairment, your sense organs is no more working like hearing, smell, touch, taste, etc. No more normal. Okay, it is not normal. And cognitive or learning disability, it is related to neurological disability in which You face difficulty in storing, processing, and producing the information. You face difficulty in storing, processing, or and producing the information. Therefore, if you face difficulty in reading, writing, speaking, etc. And intellectual disability is related. In intellectual disability, the IQ level of a person is low. He learn the things, but his rate of learning is slow. He face difficult. He learns slowly. Face difficulty in communicating. Face difficulty in remembering the informations and use it appropriately. Face difficulty to make a judgment, problem solving, etc. This is intellectual disability, low level of IQ.